TherapyEd's online office hours. My name is Dr. Alice Henton, and I will be doing this review on speech science and acoustics. I'll share this slide with you. These are TherapyEd's guidelines for accessing and using this presentation. So let's get started on acoustics. The first thing that we need to review is the nature of sound. So sound is a pressure wave. It moves through as a longitudinal wave through its particular medium. Usually we're talking about sound traveling through air. These vibrations are alternating areas of condensation or compressions and rarefactions. The condensation or rarefaction areas are where the particles in the medium are closest together, and the rarefactions are where they're farthest apart. So these units, these areas, alternate between being close together and then farther apart, and that's considered a cycle of vibration, one condensation and one rarefaction. So frequency is how we talk about these vibrations. We can measure that in a unit called hertz, which is the number of vibrations, the number of cycles in a unit of time. Usually we measure hertz in cycles per second. That's what that one means. So the human ear is sensitive to the frequency range of 20 to 20,000 hertz. So that's frequency. Pitch is our perception of frequency, and we can measure pitch in octaves or semitones, or sometimes our speech scientists or acoustic scientists will use a unit called mels. Most of our musicians use octaves or semitones. And you may remember an octave is a doubling of frequency. So you take whatever your fundamental frequency is and double that, and that's an octave gap or an octave span. So if you have a fundamental frequency of 250 hertz, an octave above that would be 500 hertz. If you have a fundamental frequency of 100, an octave above that would be 200 hertz. Period is a unit of time. It's defined as the amount of time it takes to complete one cycle of vibration. So we usually measure that in seconds. If frequency is the number of cycles per second and period is the number of seconds per cycle, you can see how those two units are inversely related to each other. So as frequency increases, period is going to decrease, and vice versa. Amplitude is the amount of displacement away from equilibrium. So as we go through these cycles, half of the cycle is displacement of particles in one direction, and the other half of the cycle is displacement in the opposite direction. So amplitude is the amount of displacement, how far those particles displace from that point of equilibrium. Also talk about the intensity of a sound. Intensity is defined as the power per unit area, and one common unit that we use for measuring intensity is watts per meter squared. And if you remember learning about the decibel scale, you can remember that the dBIL scale, or the intensity level scale for decibels, uses 10 to the negative 12th watts per meter squared as the reference for that particular scale for decibels. We can measure intensity with a power unit as well, and that a pressure unit, and that gives us the amount of pressure in that particular sound wave, which is a little bit different from the intensity of that wave. Pressure scale for decibels is the sound pressure level, so dBSPL scale, and the reference for that is 20 micropascals. Those reference measurements of 10 to the negative 12th watts per meter squared, or 20 micropascals, are equal to 0 decibels in each of those decibel scales. So that is our threshold of hearing. So that's the reference that's used in each of those, and those are measures of intensity and pressure. Loudness is our perception of intensity. So as a sound increases in intensity, we perceive that as an increase in loudness. There are a couple of measurements that we can use to quantify that perception a little bit. So we have the Fawn scale and Sones scale. Loudness is affected by the frequency of the sound. It's also affected by the bandwidth of that particular sound and the duration of that sound. So several things can contribute to our perception of loudness. Duration of a sound is how long that sound is present around us, in the space around us, in the air around us, and that's going to be a unit of time. Wavelength is the distance that wave travels in one cycle. That tends to vary depending on the medium that sound wave is traveling through. For example, sound waves are going to travel faster in helium than they do in regular air around us, and that's why we hear a higher pitched voice, a higher frequency voice when someone has breathed in helium. That sound wave is traveling faster because of the medium that has changed. The helium doesn't actually change anything about the phonation. It's all just change of the medium itself. And then the phase of the sound wave. Phase refers to the location of a particular point in a waveform cycle relative to that zero line. And that zero line is that equilibrium that runs through the middle of that sound wave, that point where there is no movement at all in that sound wave. And we measure phase in degrees, just like degrees of a circle. So it's going to be any number of degrees from 0 to 360 degrees. When we add waves together that are in phase with each other, it means that those waves are displacing in the same direction at the same time, and those waves are going to add together to increase in amplitude. When we have waves that are out of phase with each other, one wave is displacing one direction and the other wave is displacing in the opposite direction, so they interfere with each other in a way that leads to decreased amplitude in that total sound wave. I mentioned waveforms. Waveforms are one of the ways that we can represent a sound wave in a graph. In a waveform, we have time on the x-axis, so running on that horizontal axis. Then on the vertical axis, we have amplitude. We might also use intensity or pressure, but typically we're going to look at that as amplitude on that vertical axis. So time, horizontal, amplitude on the vertical. And that waveform just looks like an S, basically going up above the equilibrium line and then down below the equilibrium line, and then back to that zero line, and then it'll go above the line and then come back down and go below the line. So it just alternates, those cycles. So we draw it like it has a crest and a trough, but actually sound wave is compressions and rarefactions. But we draw it that way, and that's the waveform version of that sound wave. When we see a waveform It doesn't directly tell us about the fundamental frequency, but we can determine the fundamental frequency because we have the waves there and we have the amount of time in the measurement there on that axis. So we can calculate what the fundamental frequency is. The waveform also allows us to see voice onset time. We can see how periodic a wave actually is, and we can see changes in pitch. So we can see some of those pitch contours that happen across an utterance or across an extended vowel. If you're holding out a vowel for a period of time, you can see how that frequency changes a little bit. So a second way that we can represent sound in a graph is with an amplitude spectrum. In a spectrum, we have frequency on the horizontal axis, on the x-axis there, and on the vertical y-axis, we have amplitude again. So this ends up looking like a vertical line at each frequency point that's represented in that sound. So if you have a pure tone, if you have a single frequency, then you have a single vertical line because you only have one frequency represented in that sound. So you'll have a vertical line at whatever the amplitude is, at whatever the loudness level of that particular sound wave. And it'll show you the frequency and that amplitude or the loudness there. Amplitude spectrum allows you to see harmonics more easily, and you can see how the energy in a sound changes across those harmonics. You can see how loud each of the frequencies is with respect to the other frequencies that are represented in a sound. And then we have spectrograms. Spectrograms have time running on the horizontal x-axis, and on the vertical y-axis we have frequency. We can look at spectrograms in two different ways. We can have broadband spectrograms or narrowband spectrograms. Broadband spectrograms look at wider ranges of frequencies, and we're able to see more subtle, more slight changes in frequency energy when we're looking at a wideband spectrogram. When we're looking at a narrowband spectrogram, it's easier to see harmonics because we have narrow ranges of frequencies represented. So we see those individual harmonic bands more easily with a narrowband spectrogram than we do with a broadband spectrogram. But with a narrowband, it's harder to identify small changes because sometimes those small changes are going to happen between those harmonic bands. And we may not always see that information if we're only letting narrow pieces of information through that filter, which is what the broadband and narrowband is actually showing us. On a spectrogram, what we're looking for is where the energy is, what frequencies have the most energy in a particular sound or in a word or in an utterance, what frequencies are represented in that sound. And we can see that by looking for the areas that are darker. The darker the space on that spectrogram, the more energy there is there. So the lighter areas that are light gray or white in a particular spectrogram are where there's less energy. So we're looking for those darker areas, and that's going to be that formant information, if you remember that from your speech science class. All right, so sine waves or sinusoids show us a pure tone or a single frequency sound wave. This is one way to represent simple harmonic motion, which is what we see when we have a pendulum or a spring that's oscillating back and forth. You set that system into motion, and it's going to keep going at that same rate, the same amount of displacement, the same frequency, until some outside force interrupts it or stops that movement or adds energy to the system, either way. But that system is going to keep going at that same frequency and the same amount of displacement until something decides to change that, until something else acts on that system. And that is simple harmonic motion. If you look at a sine wave a sine wave in a regular wave form, it's going to be symmetrical, it's going to be periodic, because again, it's one frequency, and that frequency is just going to continue unless it is interrupted. It's just going to keep going at that same frequency indefinitely. And it's going to be symmetrical, meaning the amount of displacement in one direction is going to be the same as the amount of displacement in the opposite direction, and each cycle is going to look just like the next cycle of vibration. So that's the periodicity of that wave, is how regular that pattern is from one cycle to the next. In a waveform for a sine wave, for a pure tone sine wave, you'll see the peak amplitude, so the maximum amount of displacement from equilibrium, at 90 degrees, and then again at 270 degrees. So if you remember what we were saying about thinking about wave movement, or the phase of a wave, as if it were degrees on a circle, that 90 degree mark is 1/4 of the way through that cycle. So when it's displaced as far as it's going to go one direction, that's your 90 degree mark, and then it's going to come back down to equilibrium, and that's halfway through the cycle, and then it'll displace the opposite direction, and that's your 270 degrees, and then back to 360, and you're at that zero line again, running through the middle of that waveform. If you look at a pure tone in an amplitude spectrum, what you'll see is a single line at the frequency that's represented there. So you'll see a single vertical line showing you the amplitude and the precise frequency of that wave. Complex waves are combinations of multiple frequencies in the same space, in the same sound. It's multiple frequencies that are combined, so it's no longer a simple wave. It's no longer a pure tone. You have multiple sounds coming together as one. A complex wave can be either periodic or aperiodic. If that complex wave is periodic, then that pattern is going to repeat. It may not be a simple pattern like a sine wave or a sinusoid curve, but it can repeat. And if it repeats, it is periodic. When you see a periodic complex wave, the fundamental frequency of that system, of that periodic complex wave, is going to be equal to the greatest common denominator, which is the largest whole number that can be multiplied to give the frequencies that are represented in that complex sound. So if you have 3 frequencies being played at the same time, you may have a 100 hertz sound and a 200 hertz and a 300 hertz sound. The least common, or the greatest common denominator for that, is going to be 100. That's the smallest of those frequencies. It's the one that you can multiply to get the other frequencies. most easily. So greatest common denominator, the largest whole number that can be multiplied to give those frequencies. An amplitude spectrum of a complex periodic wave will have more than one vertical line. So each vertical line will represent the frequencies that are combined in that sound. So you might have a line at 100 and a line at 200 and a line at 300. If those are the frequencies that were combined in that complex periodic wave, then you'll have a vertical line at each of those frequencies. And then the amplitude of each will represent the loudness of each of those frequencies with respect to the others. You may see harmonics in that kind of system because, again, with that vertical line that you see with an amplitude spectrum, it's easier to represent harmonics of a system. So we can see those in that kind of a graphic illustration. If you have a complex aperiodic wave, you will not have a fundamental frequency. You will not have harmonics of that sound because you have so many frequencies that are combined. It's not regular. The system does not repeat. The cycles do not repeat themselves. And when you have what's considered noise. So lots of different kinds of noise, but all that means is that it is aperiodic. There is no pattern to it. A lot of frequencies combined and mixed together, and no consistent pattern on how those work together. All right, so when we get to speech sounds, speech is a complex sound wave. It's a combination of multiple sine waves, a lot of different frequencies combined together. Voice is considered to be quasi-periodic. We talk about it like it's periodic, and it is close to periodic, but it's not a pure tone. Most of us can't sing a pure tone. It's just not going to be that clear and that regular and that steady, but we can talk about it as if it were more of a pure tone because it functions closer to that than it does most of our aperiodic models. So voice has an infinite number of harmonics. Harmonics, if you remember from your speech science class, are whole number multiples of the fundamental frequency. So you can just continue multiplying that fundamental frequency indefinitely. There's no end to that because you're just multiplying those numbers. Eventually those sounds are going to be so soft that they're not detectable, but theoretically they are infinite. Spectral roll-off of these harmonics happens at a rate of 12 decibels per octave. And what spectral roll-off is the amount of decrease in amplitude from one octave to the next. We can see that shift across the harmonics because that's what we're typically seeing in that amplitude spectrum. We see those harmonics represented in that sound. Spectral roll-off is that decrease in harmonic energy, the decrease in amplitude of those harmonics. And in voice, that happens at a rate of 12 decibels per octave, not per harmonic, but per octave. Intonation is how fundamental frequency changes across an utterance. This intonation is what contributes to our perception of prosody. We can recognize when a sound is supposed to be stressed or emphasized more, when a word is stressed in an utterance. We hear those changes because of changes in intonation. So that's changes in loudness, changes in fundamental frequency that work together to give us that kind of energy. Typically, we see our fundamental frequency increase on more stressed syllables. That's one of the ways that we show that that is stressed. We raise the pitch, we raise that fundamental frequency of the word or the syllable that we're trying to emphasize. So there are different kinds of tonal languages that use pitch and voice in different ways. So some examples here in the slide of the Hmong languages, East Asian, African languages, Japanese, Scandinavian languages that use changes in tone, changes in pitch to indicate different phonemes. So in English, that kind of shift is meaningful, but it's because of changes in prosody. We hear those and we interpret meaning a little bit different. We can hear if someone is making a joke or if they're trying to be serious or funny or ironic, whatever it is. We can hear that and interpret the meaning a little bit differently, but it doesn't change the word itself. It doesn't change the phoneme. But in some languages, those changes in pitch do indicate changes in phonemes. Periodic complex sounds in speech are produced when airflow is obstructed in some way. We have different kinds of aperiodic sounds. We have impulse noises, which are our stop consonants. Some languages use tongue clicks. That's not really a phoneme. In English, we do have that. Like if you're trying to, make a sound to cue a horse or something and make a little kind of sound, that kind of a tongue click isn't a phoneme for English, but it is in some languages. But those kinds of sounds are impulse noises. They're made when we have a sudden release of air that we've had closed and confined for a short period of time. When we release that air all at once, it produces a different kind of sound, and that sound is aperiodic. We also have some sounds that are produced from turbulent noise. So those are going to be typically our fricatives, are best examples of that. We have sounds like our affricates that are combinations of stops and fricatives, but those that have that fricative component are longer in duration than the impulse noises, and we're forcing air through a smaller space. So we're hearing that frication, we're hearing that noise as the air goes through that smaller channel. We can have voiced and voiceless fricatives. It's important to think about the number of sound sources that each of those actually has. So when we have an unvoiced fricative like s, there is a sound there. We do hear a sound, but that sound isn't coming from phonation. That sound is coming from the noise coming through the passageway, coming through that constricted channel that we formed in our mouths. So we've got that source of noise, but no phonation. In a voiced fricative, we have both the frication and phonation. So our voiced fricatives have one source of sound, and our voiceless fricatives have one source of sound. Our voiced fricatives, still think I said those backwards. Our voiceless fricatives have one source of sound energy. Our voiced have two sources of sound energy because voiced has the phonation with it. The source filter theory of speech production is also called the acoustic theory of speech production. This theory says we have a source of sound energy, which is generally considered to be the vocal folds. But to get those vocal folds in vibration, we have to have air moving through the system. So we have to have the respiratory system providing the power for that. So it's driven by respiration, but then the column of air is set into vibration by the vocal folds, by vibrating vocal folds. So that's our source. And then the filter is everything above the level of the vocal folds that then shapes that air column and forms it into either vowels or consonants according to where those constrictions are, where the sound is resonating the most. That filter is also called the transfer function of this system. It's telling us or showing us, if we're looking at it on a spectrogram, showing us how that sound is being changed, how it's being modified in the filter, before it comes out our mouths or as it's coming out of our mouths. So some frequencies get amplified. Some frequencies are going to resonate more in a cavity of a particular shape, and some frequencies are going to get attenuated. They're going to get damped or reduced a little bit, depending on how we've shaped that cavity and where we have the constrictions, whether we have nasal resonance or oral resonance. All of those things go together to determine how that sound is shaped. We have the radiation effect, which is as the sound is leaving the lips, we have a 6 decibel boost in sound energy. And that's related to some of the sound, as we have this air column that's coming from our lungs through the vocal tract. As that sound gets to the area of our lips, we've got our teeth and our lips right there on the end of this passageway. Some of the sound is going to leave our mouths. Some of the sound is going to hit a barrier and bounce back and get amplified again and kind of resonate more in that system. And that's where we get that 6 decibel boost in energy, that 6 dB gain as the sound is leaving. So that's that radiation effect. The larger the resonating cavity, the lower the frequency that's going to resonate in that space. So when we have a large cavity, we have lower resonances. When we have a smaller cavity, we have higher frequency resonances. So our speech output, the nature of the sound, the frequencies in the sound that actually comes out of our mouth is going to change as a function of what's happening with the source and what's happening with the filter. So that's the whole concept behind the source filter theory. We can look at that sound that's come out of our mouths. We can look at that sound on a spectrogram and see the frequencies that are resonating. Those resonant peaks or bands of energy, those are formants. Those are the dark areas on that spectrogram. And those are the frequency bands that are the most resonant in that particular filter shape. when we have our tongue in that position, our lips in a certain position, velopharyngeal port, open, closed, whatever's going on with all of these articulators. The spectrogram is going to show us the frequencies that are the most resonant in that shape of filter with that particular source, and that's the formants. We have different acoustic characteristics of this supralaryngeal vocal tract. So you'll see SLVT, and that stands for the supralaryngeal vocal tract, and that's everything that's above the level of the vocal folds. What's happening with the shape of that chamber? When we have that in a neutral position, the sound that we produce is that neutral schwa in the middle of that vowel quadrilateral. That neutral space in the middle is our schwa, where our system is the least tense and the least stressed and shaped. So we have an essentially uniform diameter of this tube, of this resonating cavity from our vocal folds to our lips. It's essentially the same diameter, that entire length. So we get a simple, relaxed, easy sound. From the closed end of the tube, which is at the glottis, to the open end of the tube, which is at the level of the lips. When we have a tube like that, that's closed at one end and open at the other, we have what's called a quarter wavelength resonator. Okay? When we have a quarter wavelength resonator, like our vocal tract, the lowest resonating frequency in that vocal tract has a wavelength that is 4 times the length of that tube. So if you think about how that quarter wavelength resonator works, what it's saying is that 1/4 of a wavelength, and a wavelength is a full cycle. So 1 compression, 1 rarefaction, or 1 crest and 1 trough if you're drawing a waveform. That's 1 cycle, and it's 1 wavelength. So 1/4 of a wavelength is from that neutral point halfway through that first crest to that maximum displacement point of that first crest. That's 1/4 of the way through that waveform. So that part of the wave is the simplest, the lowest frequency that would resonate in that space. So a quarter wavelength resonator resonates best at frequencies that are odd multiples of that first quarter wavelength. So 1/4 of a wavelength, 3/4 of a wavelength, 5/4 of the wavelength will resonate in that space, those odd multiples. Okay, back to that quarter wavelength. The fundamental frequency that gives us that first quarter wavelength is going to fit in the length of that vocal tract from the glottis, which is closed, to the lips, which are open. So we get 1/4 of a wavelength in that space. So to figure out the wavelength of the full wave, the full wavelength of that particular frequency, it's going to have to be 4 times the length of that vocal tract. 4 times the length of that tube will give you the full wavelength of that fundamental frequency. And then we have the odd multiples of that fundamental that resonate in this cavity. The supralaryngeal vocal tract is a variable and broadly tuned filter. It's variable because we can change the frequencies that are going to resonate the best. We can move the areas of that constriction. So we can have high vowels and back vowels and low vowels, and we can have fricatives that are alveolar, and we can have velar stops, nasal sounds. We can do all of these things with the shape and with the constrictions of this vocal tract. So it is variable, and it's also broadly tuned. Excuse me. It's broadly tuned, meaning we're going to get not just the single frequency right there at the center of that space. We're going to get the frequencies that are closest to it. We're going to get this range of frequencies that are close to the frequency that we're creating from the shape of this constriction. We're going to get the ones that are close to it. So it's going to go a little bit wider. It's not just a narrow set of frequencies that we're going to hear. We're going to hear that broader space of frequencies. This vocal tract, again, has an infinite number of harmonics and formants, for that matter. So harmonics and formants can just go on indefinitely. We don't need all of those harmonics or formants to understand speech. So they may be measurable, but they're not always necessary for discrimination or for understanding language. But they are there. They are part of that system and can be measured. We typically only need the first 2 or 3 formants to be able to identify and discriminate our phonemes. So those are the ones that we're going to talk about the most when we're talking about the formants of all of our phonemes. Some of these frequencies get damped or attenuated, and some are going to get amplified as they pass through this filter. So that's what we end up seeing on that spectrogram. We see the result of those kinds of effects on that fundamental frequency that's passing through that cavity. So thinking about how sounds resonate in this space, we have what's called the incident wave, and that incident wave is that first wave that's created as that air column passes through the vocal folds and is set into vibration there at the level of the glottis. So from there to the lips is our incident wave. And from there, that wave either continues out into the air around us, or some of it might get reflected back. If the wave gets reflected back, it's going to have some sort of interference with the incident wave that's continuing to come off of the vocal folds. So we have some of the wave that's continuing to travel forward and trying to exit our mouths, and then some that's returning on that reflected wave. So those two are going to interfere with each other in some way. We can have constructive interference. So if those waves are in phase with each other, then they are going to add together in amplitude and get louder. If they are out of phase with each other, then they will have destructive interference and they will decrease in amplitude. So those are some of the sounds that get damped, get decreased, and the ones that have constructive interference that are in phase with each other are the ones that are going to get amplified, and they're going to resonate a little bit more. The ones that resonate create what's called a standing wave. And with a standing wave, you may remember we have nodes, which are the areas of no movement in the wave, and then the antinodes where there's maximum movement or maximum displacement there. We have nodes and antinodes of that standing wave, and that's showing us how that wave is resonating. It's showing us the frequencies that are the most resonant based on the shape of the vocal tract. If we have destructive interference, those sounds that get decreased in amplitude, get attenuated, will actually get filtered out of the system. They're not going to get amplified. They're not going to be important in the spectrogram, in the frequencies that we use to discriminate and identify that particular speech sound. So less important in that process. So they're going to decrease and just kind of fall out. Characteristics of resonant sounds. So if that sound is periodic, it's going to resonate better. These sounds are our vowels. Nasals are highly resonant. They're more periodic. And then phonemes are consonants like liquids and glides tend to be more resonant. There's more sound energy there than there is with some of the other sounds. So with these, that vocal tract is more open. Vowels, of all of our phonemes, the vowels tend to have the most open vocal tract shape. So there's a lot of energy there and a lot of resonating space for those. Formants are determined by the size and the shape of the pharynx and the oral cavity, and by the location of those constrictions. So that's how we get the terms that we use to describe like front vowels and back vowels. That's where the constriction is. Each sound is identified by the relationship among those first 2 or 3 formants. So F1, F2, F3, how close those are together, how far apart they are, what is the relationship between those formant values. So what frequency is that first formant? What frequency is the second formant or the third formant? How close are they to each other? That's how we identify whether that vowel was an E or an A or an Ah or an I. We hear those relationships. Even if we can't see a person's face and speech read those sounds, we use that formant information and the relationship among those formants to identify what the sound is. So the actual formants, the precise value, is going to vary. It's going to vary speaker to speaker. It's going to vary in the same speaker from one utterance to the next utterance. You could say E 3 times in a row, 10 times in a row, and it's going to be slightly different each time. And that's okay, that's normal. But they're going to be relatively similar and more similar than they are dissimilar. So that's why we'll hear it and we'll process it as the same vowel, because it's more like an E sound than it is like an I or an E. So we hear it as that same vowel. So a speaker's gender and size, the speaking situation, even our rate of speech and the phonetic context of those particular sounds can influence what those formants are. So what are the phonemes immediately preceding or following a particular phoneme in speech? What's right before, what's after? That's going to determine a little bit of the shape of that target phoneme in the middle. So it may shift those formant frequencies a little bit. So lots of things can make slight changes, slight variations in that exact formant number, but it's still that relative space that's the most important for our auditory discrimination of that sound. So we're looking at those first three formants. F1, the first formant, is most closely associated with pharynx size or tongue height. So the larger that pocket of air, the lower the resonating frequency. Our high vowels and even glides like yeah, so the high vowels would be E and U, and glides like yeah, which starts kind of like that E sound, have the highest tongue position. So if we have a high tongue position, we'll have a low F1. So our phonemes that have the highest tongue position have the lowest first formants. Those two are inversely related to each other. So our vowels and consonants with the lowest tongue position, like ah, will have the highest first formants. So inversely related. F2 with the second formant, that is most closely associated with the size of the oral cavity or tongue advancement, how forward or back the tongue is. Our front vowels have the most forward tongue position, so they have the smallest air pocket and a high F2. So our front vowels have a really high F2. Back vowels like oo and o have the lowest second formant. So as we move from front to back around that vowel quadrilateral, you can see that second formant gradually falling as you go from the highest and most forward E around to the most back oo. You see that second formant gradually falling. F3, not as significant for discriminating most of our vowels, but F3 is super important for that retroflexed R. That's actually one of the keys that you can use for trying to treat those resistant R errors, is use some of this spectrogram information for biofeedback and watch for that low third formant. When you get that shape, you're going to get the more correct R production most of the time. So that F3, you're going to see constrictions at lips, at the hard palate, and in the pharynx, and get a low F3 when you have all of those areas constricted, which is largely what we have when we're producing that retroflexed R. So the greater the constriction, the lower the amplitude of that sound. Our resonant consonants tend to have lower amplitude than our vowels do. Our vowels are more open than the resonant consonants. When we have nasal consonants, we get what's called zeros or anti-resonances or anti-formants. You'll see all of those terms. And that is an area where we've created a larger resonating cavity. So when we have nasal resonance, we've opened up that velopharyngeal port so that we get resonance all the way into nasal cavity, which is a larger space than what we would have had in the oral cavity. So we've increased the size of that space, but also deflected the energy a little bit. So that creates this alternate resonating space with lower frequency formant. So it's lower frequency because it's a larger space, but the sound gets absorbed into the tissues differently, and that's going to decrease the energy that we see in that spectrogram, the energy that we see in that phoneme production. And that's why it's called an anti-resonance or an anti-formant. It is resonating, but it's not resonating with the same kind of energy that we see in our oral resonant sounds. So that's the nasal resonance. We get the zeros or anti-resonances. With our liquids and semivowels and glides, they function acoustically a lot like our vowels. They are vowel-like. The vocal tract is less constricted in a similar way as we see with our vowels. But the amplitude, the energy is decreased. The energy is less. Particularly with that L sound, we also see zeros or anti-resonances with that, because when we make that L sound, we've got the tongue tip elevated and the sound is moving on the sides of the tongue. That's why it's called a lateral sound, right? So we've got sound moving to the side. So we've again put a division in that resonating cavity, just like we did with opening up that velopharyngeal passageway for our nasals. We've created a division. This time the division is in the middle of the oral cavity, so we have air going on each side. And that division is what's creating those anti-resonances. So we see that same kind of decreased energy that we saw in the nasals. We see that with L production as well. Our obstruent sounds. Obstruents are relatively constricted and they have more turbulent air. So we have, again, that aperiodic noise. So our stops, fricatives, and affricates are the ones that are going to create this aperiodic sound and have this constriction that we see with obstruents. This aperiodic noise is distributed across a range of frequencies. So it's not just a small range of frequencies. It's going to be a little bit wider range of frequencies that we see, and it's not focused energy. It's a lot of frequencies in that space, which is what's making it aperiodic. So not as focused. We have voiced and voiceless obstruents. Our voiced ones are shorter in duration than their voiceless cognates. So if you practice with some minimal pairs where the only difference is the voicing of those two consonants, then you can probably hear a little bit of difference in the length of those consonants, the length of those phonemes in the words. When the constriction is near the front of the mouth, we have higher frequencies that are enhanced, and when that constriction is near the back, we have lower frequencies, and you can hear that difference with fricatives like s and sh, s is an alveolar. Sh is a palatal sound. So the fricative, the alveolar, is more forward. And you can hear that that's a higher frequency, a higher pitched sound than the sh, than the palatal sound. And again, we have one source of sound with those. The only source of sound is that frication. It's not voicing. So it's the place of that articulation that's giving us the cue about whether that's an S or an SH sound, right? So more forward, you've got a smaller space, higher frequencies. Further back, larger space, lower frequencies get amplified. Cues to place of articulation. We see cues in the transition information. So again, if you're looking at spectrograms, the transition information is how that energy changes as you're moving from one phoneme to the next phoneme. As you're transitioning from that E to the stop consonant that follows it, or to the fricative that follows it, how is that energy changing? And we can see if the frequencies are going down, that can tell us one thing about the place of articulation of the next sound. If the frequencies are going higher, that's a different kind of cue. So we watch for that transition information. It's particularly helpful with that second formant for our consonants. We see these kinds of shifts also with our diphthongs. So diphthongs, as opposed to pure vowels, diphthongs, you have two vowels that are smushed together in the same space, in the same kind of the same letter. It's this, they're functioning like a single sound, but it's really two pure vowels that are working together, that have teamed up. So when we see a diphthong in a spectrogram, when we look at that acoustic print, we can see how those formants shift from the first part of the diphthong, from the first half, which is the on glide, to the off glide, which is the second part. We can see how that moves. And for a diphthong, that change tends to be much slower than it is for consonant shifts. If we have bilabials, a bilabial constriction brings all of the formant frequencies down. So if we have a vowel going into a bilabial stop, we'll see all of those formant frequencies coming down as it's coming out of the vowel and going into the closure for that stop. You'll see all the frequencies go from higher frequencies down to lower frequencies. So we look for those kinds of shifts to tell us about place of articulation. So cues for fricatives. We've talked about S and SH a little bit. And the frequencies there. Acoustic cues for stops. So we see or hear the acoustic cues for stops in, there are really 4 different spaces. We have the stop gap, which is the space where we've stopped the airflow. We've restricted that. We're letting the pressure build up behind that stop closure. So we have that time, because time keeps going in our spectrogram. So we have the stop gap there where there's no air moving. We have that stop cue. We have the voice onset time, which is the amount of time between the release of that stop and the onset of voicing. So if we have voice onset time that is negative, simultaneous, or short lag, then we have what we perceive as a voiced stop. And if we have a voice onset time that is long lag, then we have what's perceived as a voiceless stop, because there's a lot more time before we start to hear the voicing again. So it's like our brain processes that voicing as significantly later than the release of that stop. So it's enough past that release that our brain says those two were not related. So we process it as a different sound or connected to a different phoneme. So we have the stop gaps, we have the voice onset time, and then we have the release burst. So when we release that air that we've had constricted there, that we've had stopped, when we release that, there's a little bit of a sound. There's a little bit of an energy burst that we can see in that spectrogram. So when that happens, it shows up on the spectrogram as a different kind of energy. So if we see that or hear that release, we can process that as a stop. And then the fourth component really is that transition information that we talked about on the previous slides. So we can see in all of that whether it's a voiced consonant or if it's a bilabial or a velar consonant. If it is a bilabial, we'll see the formant energy decreasing in frequency. If it is a velar stop, we'll see what's called a velar pinch, which is where the second and third formants get pinched together. So we see those cues. If it's an alveolar stop, that energy tends to be more flat in the frequencies. We don't see significant shifts in the frequencies there, but we do see significant changes in bilabials and in velars. So you can see those. And then measurement of vocal fold vibration. So with this, we can measure the frequency. We can measure the fundamental frequency. We can see those pitch contours. We can see how pitch is changing across an utterance and get information about overall prosody of speech from that. We can measure the stability of the fundamental frequency, the stability of the sound. If the frequency changes from cycle to cycle, that's called jitter. If the amplitude or the loudness of a sound changes from vibration cycle to vibration cycle, then that's shimmer. And either of those can give us clues about the quality of a voice. Sometimes those are connected to particular diagnoses. Jitter measurements and shimmer measurements are not necessarily tied to particular diagnoses, but if we see abnormal measurements, we can use that information to help with a differential diagnosis. But a particular numerical measurement doesn't always point to a particular diagnosis. It's part of the bigger picture that we can use. And then we can look at the quality of the voice, if it's a healthy sounding voice, if it's a creaky or low voice, or a hoarse sounding voice, a particular breathy voice. Those kinds of descriptors are related more to the kind of vocal fold closure that we're getting. So whether we have complete closure or really pressed tight closure or incomplete closure, those all contribute to the quality of that voice. And then changes in the mode of vibration is described as spectral tilt. And we can see this when we compare the amplitudes of the different harmonics. We can compare that kind of energy and or those that harmonic energy and interpret spectral tilt. And then the last one is harmonics to noise ratio, and that is a measurement of the harmonic or periodic energy in a sound compared to the noise in a sound. And if you have high harmonic to noise ratios, then you have a lot of harmonic energy and very low noise ratios. That's going to be a purer sounding voice. If we have high noise and lower harmonic energy, so it's going to be a lower harmonic to noise ratio, so higher noise, lower harmonics, then that tends to be a rougher sounding voice, a voice that we perceive as damaged, less good, less ideal in some way, often a diseased or damaged voice in some form. All right, and that is the review of the acoustics unit in the TherapyEd book.